These are the faces of the View-UCLA Medical Center Foundation, participants in an innovative community-based health education program.
Our nonprofit foundation was formed in 1986 from volunteers from the hospital and the local community.
View is a Los Angeles County public hospital, as well as a teaching facility affiliated with UCLA School of Medicine, and has no funds allocated for public health education. The Northeast Valley is impoverished and underserved, with the highest unemployment and uninsured rate in the San Fernando Valley. Most participants in our program speak Spanish and have lower than a third-grade reading level. Lack of transportation prevents them from accessing even basic health care. The foundation was established to supplement the hospital's community outreach needs by providing an underserved population with health education programs and services. This promotes preventive care and healthy lifestyles and can reduce reliance on expensive hospital care. We hold focus groups at schools, churches, and various community centers. People come in, discuss their health needs, tell us what programs would be beneficial, and we learn what the community thinks it needs. We determine ways to tailor each program to the characteristics of the community and design the tools necessary to deliver the programs effectively. When identifying and evaluating programs in response to a community concern, we try whenever possible to collaborate with other community groups.
Our keynote program is our Healthy Beginnings program, and it provides education to a hard-to-reach community. Participants in this award-winning program learn about pregnancy, nutrition, breastfeeding, and how to care for their baby in the first year of life. They also receive home visits, resources, and referrals. The program is regularly updated and covers welfare changes, domestic violence, and sexually transmitted diseases.
The foundation provides jobs by employing promotoras, lay people who have become leaders living in the community. They learn the established curriculum, teach, and even recruit students into the program. Most of the promotoras are bilingual, although some speak only Spanish.
I love my job. I help my friends and my neighbors.
Each year, nearly 150 women and their babies have graduated from this program.
I learned so much from this class, and now I have a beautiful, healthy baby.
Complications of low birth weight and high-risk pregnancies have been reduced by these classes, decreasing the need for neonatal intensive care. The cost of just one day in neonatal intensive care is nearly $4,500, but prenatal care and education can greatly reduce or eliminate this cost, saving local taxpayers meaningful dollars.
Yeah, the Arthritis Empowerment Program is really one of our leading programs within the foundation, and it's actually an outreach to the community to empower those people with arthritis. We know that there are more than 10 million people in the United States with arthritis. The foundation responded by adopting the Stanford University Arthritis Empowerment Program, fine-tuning it to the cultural needs of the Northeast San Fernando Valley population. This award-winning program teaches students about pain management, exercise, general information about the disease process itself, and how to communicate with their doctors.
Exercise is part of the program because it helps with mobility, pain, and quality of life. People feel that they are the only ones suffering, and knowing others in the program can help and empower them. After the class, participants often form their own ongoing support groups. At the beginning of the class, we pre-test the participants. Then they attend a 2-hour class for 6 weeks, and we test them again. After 4 months, we follow up with testing for pain and flexibility.
But just changing the pain threshold in a patient can make a 100% difference in their daily lifestyle, and that's what they're telling us.
Each year, 500 people successfully graduate from these classes. In the Foundation's focus groups, 17% of the participants were concerned about diabetes, making it one of the group's highest priorities. Diabetes is very common among Hispanics, affecting 1 out of every 8 people. Many people have diabetes for years without having any symptoms. However, diabetes that is not treated can have serious, life-threatening complications, ranging from blindness to stroke and kidney failure. In keeping with the philosophy of responding to health needs prioritized by the community served, the Foundation began offering the Diabetes Outreach Program. This ongoing Foundation program is offered in collaboration with the American Diabetes Association, Valley Healthcare Clinics, and the Los Angeles Public Health Nurses. The seminars are given in Spanish and provide information about diabetes and treatment, which includes a healthy diet, exercise, and medications. Our focus groups also identified a need for education about asthma in adults, a common respiratory illness.
The asthma self-management program was developed from other programs that exist around the country, but it was adapted to fill the needs of our population in the Northeast San Fernando Valley. It has been translated into Spanish and adapted to local needs. We have similar plans for cancer awareness and for cardiac disease programs.
The Foundation already augments existing cancer programs by providing access information regarding the state's breast cancer early detection program for low-income women. The Foundation also supplies Spanish-English handouts that teach women the proper technique for breast self-exams. In addition to the health education programs, the Foundation has created a comfort care room for terminally ill patients at Olive View. This converted hospital room accommodates family members who wish to stay with terminally ill patients during this most difficult time. Together with other community groups, the Foundation holds an annual holiday party in December for all the pediatric patients at Olive View-UCLA Medical Center. Toys, cookies, and entertainment bring smiles to the faces of more than 1,000 children at the hospital. The Foundation does not receive any government grants, relying instead upon funding from other foundations, corporations, and generous support of special events. One of those special events is the Foundation's annual dinner, at which the prestigious Nellie Reagan Award for Distinguished Community Service is presented. The award was named for President Reagan's mother, who volunteered for many years at Olive View in the 1950s, when the hospital was a tuberculosis sanitarium. Though the disease was highly contagious, she visited the patients weekly. Ronald and Nancy Reagan approved the award, and family members Michael Reagan and Patty Davis remain involved with the Foundation. The annual award is given to an individual who exemplifies Nellie Reagan's spirit of volunteerism and commitment on behalf of the communities of the San Fernando Valley. This heritage of compassion and commitment is the vision that guides the Olive View-UCLA Medical Center Foundation. The Foundation has a mission to fill a gaping hole in public health care through a private enterprise that empowers individuals by providing knowledge.
Not only is education a compassionate thing to provide, but it is also important because it can serve to help the underprivileged people in our community and ensure that by giving them understanding of healthcare, we can prevent the need for the expenses of public hospital care, particularly for those diseases and those conditions that can be managed at a community level by educated people in the community.
Formerly faceless, the unreachable multitudes have become informed participants actively managing their health care. Olive View-UCLA Medical Center Foundation is your community. We have many faces.